There we go. Here I am. Before I get started, I want to thank the Reitler team, and I've been very fortunate over a pretty long career to meet and work with a number of your team members, and I have to say they are first class. So I said yes to doing this because of that, and when I first sat down, I said to myself, how am I going to consolidate 40-plus years into 10 to 15 minutes? Anyway, a very quick recap on myself. I graduated from grad school in the 80s. Really didn't have any great direction except some banking finance understandings. So I was able to put a business plan together. My father came to me with a crazy idea of starting a magazine directed at doctors. He had worked for a pharmaceutical company for his whole career path. So we launched it. Unfortunately, my dad's idea wasn't the greatest idea in the world. But in the 90s, as Adam just sort of shared, things changed, the advent of direct-to-consumer advertising. So it allowed pharmaceutical drugs to actually advertise to the consumer. And obviously being engaged with patients and providers prior to that allowed us to create a series of publications and transform the company into a health monitor network, which allowed us to focus on the patient side, which truthfully is a key ingredient to closing the gaps in healthcare. So quick, so how do you follow innovation? I guess that's always been, and of course when I first were in the business, there wasn't a whole lot of tech innovation. But I really found by working, and being in the front line with clients allowed me to absorb all the challenges that they were being faced. So, that aspect allowed me then to come back and put together concepts that would allow me to sort of be on the leading edge. And the little secret sauce there is that when we worked with clients, and we had, amazingly, we had really good renewal rates. I would always go in and offer a value add of some special extra component that would be some kind of what I thought might be the next thing that would be really popular and really in demand. And our clients loved it because they thought, okay, we're not spending any money on this, but we're adding this as a part of our package, and let's test it and learn. And what I found often that we had some good ideas and it really worked. So in '95, when the consumer advertising started, I launched publications, disease education publications, which measured and tested control studies showed that it actually got more patients prescribed and more patients staying on therapy, which kind of amazed me. But quality content, quality education can make that difference. In 2009, following a series of additional things that I offered our clients, initially paper posters that we would stick up into exam rooms of doctors' offices, the digital age finally came to pass, and iPads were around and so forth. And I said, well, couldn't we get a supersized iPad and put it into the exam rooms of doctors' practices? And for twofold. One would be for infotainment, because back in the day you would go in and sit in the exam room, and unfortunately you would wait for the doctor in your shorts until they come in. And this provided a chance for them to actually educate themselves. They actually could use the screen as an interactive tool, or at least entertain themselves because the screens would flip. For providers, instead of having the old yellow charts, you could actually use it as an interactive tool to show a patient a heart, joint, and so forth. In 2014, obviously the mobile world came to the forefront, and health and apps and so forth. And I said, we've really got to do something. I was approached by who is one of my co-founders now of my new company, a doctor who's a neurologist. He treats migraine patients, and he said to me, Eric, I tell my patients to go home every day and keep a diary, and they don't do that. They come back, and I really can't treat them properly if I don't know this information. So we said, okay, we'll create a migraine app for you, and and he said the key to it to be successful is allow the data to come to me as a provider, so that he can actually get the information to treat the patients properly. And that sort of gave us a real opportunity to move to sort of that next phase, when in 2019, after the company continued to grow really nicely, I said to myself, there's an opportunity here with these apps. And then to reassure that, in 2018, CMS and all the payers decided to support monitoring patients at home and reimbursing the provider who treated those patients. So I launched the sole majority interest and launched the new company. The challenge in digital marketing and healthcare innovations is obviously providers are not early adopters on pretty much anything. EMR software, you talk about a tech world and all the abilities and all the interfaces we all have that are really easy to use and so forth. They're all siloed. There's no good communication between them, and they're not user-friendly. And physicians, providers just do not like workflow interruption. So how do you get technology to really make a big jump and be able to ride that wave? And what motivated me to continue is that value-based care is at the forefront. And so seizing on what can actually be, the opportunity, and that's, the ability to actually sort of see that you can see the tide finally, like the Titanic finally changing its course. And that came from a series of events. Payers push away from fee-for-service. They really want to support cost containment, and the best way to do that is to make the provider responsible for that patient. Obviously, seniors are more willing to use technology. Smartphones are everywhere. Digital devices, billions of dollars being invested in digital devices now. I mean, your home will have so many different ways that you can be monitored. And patients really prefer to be supported at home and have local support. Providers and staff are overloaded. They just have no time with patients. The average doctor spends about 7 minutes. And AI, and I was fortunate to meet a couple of ladies who seemed like they've started an amazing company in the AI space, but that will be the next phase to really push the needle in the healthcare tech world, is the advent of AI to be able to really take all the data that you could accumulate in the healthcare space and actually utilize it in a very productive way. So what happened to me? So I exited and had the money. I saw this opportunity, and after 40 years, you don't get too many opportunities handed to you, or you see that there's a great way of actually making a big difference in the healthcare space and actually improving the outcome of patients. So after my exit, I took the mobile applications that I started with the previous company and started RPM Healthcare, which is a way of supporting patients at home. It is the future of healthcare, virtual care. You're just going to see it explode in the healthcare arena just because it's just a much more efficient, cost-effective way. Unfortunately, the healthcare system is so large and so vast, and there are just so many inefficiencies. So it improves, what we're seeing is that it improves outcomes. Within 3 months, patients are lowering their blood pressure significantly. By 7, 8 months, they're under control from being stage 2 hypertensive patients. There's cost savings. Patients obviously don't go to the ER. Obviously, patients feel supported. It's like they have a family nurse. And obviously, the providers really appreciate it because they don't get all the phone calls to the patients. And it's minimal workflow interruption. That's the key for, as you're an entrepreneur, you've got to sort of get a flavor for the landscape that you're working in. And you have to be able to sort of put the pieces of the puzzle together to realize how you can align as many wins as possible. Because by doing that, and I love, it's like the old movie, The Big W, but when you make this a better thing for more people, whatever industry you're in, it's amazing how that really creates the snowball effect and of success and growth. And in this case, obviously, we're helping providers, their staff, the hospitals, the payers, the pharmacies, pharmaceutical companies. Patients are taking their medications more regularly. And of course, the most important, the patients in terms of the quality of their life. So it was fun going back, and I appreciate it, and not to mention Joyce again, but her questions were great, and it really allowed me to go back and try to reflect on the 40 years. And I think the first speaker obviously already talked about it a lot, but lead by example. From the little things of changing the coffee and making coffee to the bigger things where you jump in when there are problems and show to the team that you can do the various things that need to be done. You're one with them and not above them. Take little bets. When you're a small entrepreneurial company, you have great opportunities to try little things, and learn, and you can adapt and I sadly in the first company, Health Monitor, I had to do that a lot just to stay alive. But it provides you a huge gift that the big competitors don't have. I've already talked about creating wins for others. I mean, that is the thing you need to do, is how can you help all the players that you affect with the product that you create. We've heard this as well already, but hire more talented than you. That took me a little while, longer than I would have liked, to start hiring better, but they are a key to your success. And it was a great question. CEOs, the founders of CEOs, it's a big step, especially, if one thing having a company with 10, 15 people, when you have a company ultimately we had 140 people, you know, it's a whole different dynamic. And what you find, if you lead really well and you hire really high-quality people, you know, you can find the people who can help you in the managing side, and it all becomes a natural thing. It's not, and you can stay a CEO because you become really more their advisor, more their partner in trying to decide whatever challenges come their way. You know, what really helped me follow the healthcare innovation and do things was staying close to my customers. That is so essential. It's, you know, you can read all you want in the magazines and the newspapers, or now online, of course, but the truth is, there's nothing like hearing it from the front lines of your clients, your end user, in terms of what works and what benefits them, what they don't like. And I'm a big believer in anyone that's part of the team that's really making a significant contribution, you know, get skin in the game. Let everybody have a part, you know, a chance for that pot of gold at the end of the rainbow. So it's, and last, I guess, you know, have a mission of some kind. In my mission, when I first got into healthcare, and I found that there's such a, you know, so big, so many inefficiencies, so many gaps between patients and providers in terms of understanding or communicating to each other. You know, find that mission and then keep that focus of your mission throughout, you know, the growth of your company. And if you stay focused like that, I think you'll find you'll be very successful. So thank you all very much.